thousands pay nearly £400 a year more for prescriptions that they need to. I'm going to read into this exclusive from the iPaper, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here, an exclusive from the iPaper with the headline that thousands pay nearly £400 a year more for prescriptions that they need to. Many people who get regular prescriptions could save with a certificate that covers all their costs. Guys, just a reminder, if you haven't already, hit that like button and share it across social media. So I was notified this video because this is a very important one here. This is about people who rely on their prescriptions to whatever their medicine, whatever it is, this can save them money. And anything that saves them money is really important. Apparently a certificate that will cover all their costs rather than a regular prescription, if it is found to be more cost effective. Why do not people know about this? Or better question, why is it not being promoted enough? This is the question that we should be asking ourselves here. Especially, of course, and again, talked about this many times, about cost of living crisis, people struggling, bills going up, the minimum wage has gone up, but it's nowhere near gone up to help compensate right now with a lot of things. And a lot of people out there who rely on these medicines, and medicines are medicines not cheap, they're also becoming difficult as well for pharmacies ever since Brexit as well. So you have all these factors are in place at the moment. So anything that will help people save money is a good thing, and we need to make sure that people are aware of it. So let's dive straight into this, guys. So hundreds of thousands of patients who are paying more than they need to each year for their prescriptions, with some losing hundreds of pounds by paying for their items individually instead of taking advantage of an NHS scheme. So, prescriptions in England cost £9.90 per item, but those who need regular medicine can pay £114.50 to get a certificate that covers all of their purchases. Now, I think it's important to stress that it depends. It could also depend on how many prescriptions that they have as well. I think that's a factor you need to take into account on this as well. So, figures obtained by the iPaper show that more than 700,000 people bought at least 12 prescription items in the last financial year and could have saved cash by getting a certificate. More than 1,000 patients paid for 50 or more individual items, which would have cost them at least £495. This means that they could have saved £380 or more with the certificate. Campaigners say the figures show a troubling gap in public awareness that is costing patients cash. Rachel Power, Chief Executive of the Patients Association, said, with over 1,000 people paying for 50 or more prescriptions each year, it's clear that many are missing out on the savings offered by the prescription prepayment certificate. Our research shows that many patients are already being forced to make impossible choices between their health and essentials like food or housing, and this kind of financial strain can have a serious impact on well-being. This investigation highlights a troubling gap in public awareness that's costing patients dearly. She added that the government and the NHS should commit to a full review of the prescription charges system and collaborate with patients on a new process that is accessible, well communicated and fit for purpose. Figures obtained by the via a Freedom of Information request from the NHS Business Service Authority, that's the NHS BSA, shows that 1,136 people in England paid for more than 50 prescriptions between April and the start of March last year, with March figures being unavailable. Some 98,676 people paid for 20 or more individual items, meaning that they would have likely have paid more than £200 in total, while 703,000 paid more than 12 or more, the minimum amount that you would need to buy to save money with the certificate. In the 2023-2024 financial year, for which full figures are available, 1,660 paid for 50 or more individual items, 129,868 bought 20 or more, and 871,934 bought 12 or more. As well as a 12-month prescription prepayment certificates, PPCs, patients can get 3-month certificates which cost £32.05 and will save you money if you need more than 3 prescribed items in 3 months. These certificates cover all NHS prescriptions, including NHS dental prescriptions, but it does not cover the cost of other health items such as wigs and fabric supports. A specific hormone replacement theory, HRP, PCC, is available and costs £19.80, which can save you money if you need more than 2 prescribed qualified HRT items a year. So they've broken it down here. This is the source from the NHS HBA there. Patients who could have saved on their prescription costs. This is patients buying 12 or more prescriptions, patients buying 20 or more prescriptions, patients buying 50 or more prescriptions there. In 2023 to 2024 to 2024 to 2025, the amounts people are paying in 12 or more, in 20 or more, 50 or more there. But you can see the numbers there in terms of it. But still, those numbers are is quite extraordinary that those many prescriptions, and when in actual fact that a certificate can actually save them money there as well. And then there's the important part. Prescriptions in Scotland, Wales and Northern Ireland are free. Some people in England also get free prescriptions if they are under 16. Age 16 and 18 are getting full-time education. Age 60 or over, pregnant or having a baby in the last 12 months also or have a valid exemption certificate. An NHS BSA spokesperson said, whilst almost 4 million people used a PPC last year, we understand that not everyone could benefit from a PPC has one. There isn't a flag or notification as such, and as a patient prescription needs may change. However, the NHS BSA works with pharmacists and pharmacist teams, as well as GPs and other healthcare professionals, to encourage people to check if they could get help with the NHS health cost. The NHS BSA also carries our out targets and national promotions of PPCs, and other helps with health costs. You can backdate a PPC by up to 1 month. This allows you to potentially claim refunds or prescription costs that paid during that period there. And just the last thing here, other ways on to save on your prescription, just as a reference here in England. Although a PCC is one way to save on your prescription, there are other ways to save. You can check if you are eligible for prescription using a calculator on your NHS BSA website. If you are not eligible, some items may be cheaper to buy without a prescription. You can also sometimes get identical medicine for far less. For example, if according to moneysavingexpert.com, Sudafed congestion and headache relief day and night capsules are fine with 99 at Boots. But Savers, Growing and Max Cold and Day Relief capsules are just £1.19. Boots own brand Max and Strength Cold and Relief Day and Night capsules are £2.99. All three have an identical PL number, a unique license number given exclusively to a particular drug made by a particular manufacturer there. So that's just a couple of ways that you can get around prescriptions as well, just for reference there. But yeah, of course, it would be easier. It's very easy for me to say, oh, well, we should just have the same as England, Wales and Scotland when it comes to free prescriptions. Yes, I know, but the government ain't planning to change that, guys. I know it's stupid, and I know they should, but this is the situation. This is the cards that we are dealt with. So the least they could do is at least advertise and promote ways for people to save money on their costs, at least, especially in a cost of living crisis. Don't know how many times I need to say that, but there are some ideas there, but you know, when I was really unwell, I didn't want to take a prescribed drug, but they prescribed, the doctor recommended something when I was really, really bad, had a really, really bad chesty cough. And it did help for a long period. But I also have other means now. I think I don't want to ever take prescribed medication or drugs unless I absolutely have no other choice. So always try to find other ways of getting around it. If you are somebody who is on prescription drugs, if you have to take them, take them. However, if there are other medicines and other ways you could avoid it, especially from a cheaper way, consult your doctor next time you speak to them, because then there might be options, or consult a pharmacist and see if it can save you money. It's always a good thing, guys. But what do you guys think? What do you guys make of the situation around prescriptions? What do you guys make about the fact that people are losing out on their own money from prescriptions in England? Let me know your thoughts and more down in the comment section below. If you found this video informative or helpful to you, please hit that like button, share it across social media, subscribe to the channel if you haven't already. Do check out Rumble and Patreon for exclusive content on those platforms as well. And if you want to financially support me in the work that I do here on this channel, you can click the join button down below to become a YouTube member for as little as 99p. So thank you all so much for watching, and I hope to catch you all very, very soon.